Ekta Kapoor, consultant in the Women's Health Clinic and Division of Endocrinology, Metabolism and Nutrition at Mayo Clinic, Rochester. I've written a review article titled Weight Gain in Women at Midlife, Review of the Pathophysiology and Strategies for Management. This will be published in the Mayo Clinic Proceedings in the near future. In this concise review, we discuss the pathophysiology of weight gain in midlife women, that is, the women in the age group of 40 to 60 years, and we offer practical recommendations regarding weight management in these women. Weight gain is a common complaint among midlife women. On an average, women gain about 1.5 pounds every year in their 5th and 6th decades of life. So much so that about 2/3 of women between the ages of 40 to 59 years and 3/4 of the women over the age of 60 are overweight. Also, postmenopausal women experience a change in body fat distribution in that the excess fat unfortunately preferentially deposits in the abdominal area as opposed to their lower body, which is the pattern characteristic of younger premenopausal women. Weight gain, especially in the central distribution pattern, has several adverse metabolic consequences, including increase in blood sugar and lipids, increased risk of hypertension, and ultimately an increased risk of cardiovascular disease. Also, obesity, in particular central obesity, increases the risk of several cancers, including breast and endometrial cancers. It also increases the risk of cancer-related mortality in midlife women. Obese women tend to experience worse hot flashes, mood problems, sleep disturbances, and sexual dysfunction, all of which can significantly compromise the quality of life for these women. In terms of the cause for these changes, the most important influences are the aging effect and lifestyle changes. Aging leads to a decrease in lean body mass and a fall in the basal metabolic rate. Aging also results in changes in physical activity, which may be subtle and therefore not easily perceived by the individual. These changes lead to a fall in the energy expenditure, and unless a woman compensates by eating lesser or exercising more, she is at risk for weight gain. Also, other influences like mood disorders and sleep disturbances, which are again very common in women going through menopause, can interfere with their ability to adhere to a healthy lifestyle and can promote weight gain. Estrogen deprivation, which is related to the menopausal state, is one of the main reasons for the body fat distribution changes that occur in midlife women. Weight gain in midlife women and changes in body fat distribution are real, and the providers caring for these women have the responsibility to acknowledge this to these women and counsel them appropriately. The key message really to these patients is that the rules of the game have changed, meaning that if a woman keeps following the same lifestyle measures that she has in her younger years, she's very likely to gain weight. Therefore, weight management in midlife calls for even more aggressive attention to lifestyle. Women who enter menopause eating healthy and exercising regularly are more likely to maintain a normal weight as opposed to women who have more sedentary lives and are not paying as much attention to their dietary habits. The other important point to emphasize is that hormone therapy used in menopausal women does not cause weight loss per se, but if a patient is prescribed hormone therapy to manage bothersome menopausal symptoms, it's very likely to improve her quality of life and ability to exercise. In addition, hormone therapy in and of itself decreases the tendency for central body fat distribution. This is on the basis of the effect of estrogen on adipocytes. So the takeaway message really is that weight gain and increased central body fat are common and real problems in midlife women. These changes considerably affect the physical, emotional, and psychosocial health of women. We recommend that medical practitioners actively screen for this and offer appropriate counseling, treatment, and support to these women. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, Our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.